Like any artist, a surgeon, as a sculptor, needs to have a plan in mind. So if we look at this picture, this gives us some idea of how I will prepare a patient prior to surgery. People ask me, how do you treat somebody when they're laying down? They look totally different than when they're laying up, because we all look better when we're laying down at a certain age. So if we look at this picture, we see her at age 30. I've created with studio lights the picture of what I used during surgery. In the upright position, I mark where I'm going to add volume using her own fat. I use circles. And where I'm going to reduce the irregularities, the highlights, these are the topographical areas where I have elevations, and I want to reduce the elevations with the crosshatches. Looking at this picture versus this picture, following this map, my goal is to create a face that has the shape and the balance that then loses these irregularities. You lose that contrasting of elevations and depressions, while making sure she never looks like a different person. They're 55 years of age versus 30 years of age.